Hi, welcome to the Parenting Literacy Show. The purpose of this show is to provide information that parents can use to raise children who are physically healthy, intelligent, happy, and have good social skills and are spiritual. My name is Dr. Joseph Lau. I'm a developmental psychologist who's been studying how humans develop for more than 40 years. For the past 16 years, I've been studying parenting and how parents can best raise their children. Now, as many of you may know, April is National Child Abuse Prevention Month. And so in recognition of that, I'd like to focus on child abuse today. And we have here with us two very special guests who will help us do that. And that is Commissioner David Hansell and Deputy Commissioner Jacqueline Martin, both from the New York City Administration for Children's Services. So before we get it, I just want to talk a little bit about the nature of child abuse and why their work is so important. And then I'll proceed to ask them questions. In general, the Federal Child Abuse Prevention and Treatment Act of 2010 defines child abuse of an act or failure to act which presents an imminent risk of serious harm to the child. And so here it's important to understand that it's not just what the parents do or anybody else does that harms the child, but even what they don't do. So not surprisingly, we find that the most common form of abuse in the United States is child neglect. And this is defined as an egregious behavior of caregivers that results in a deprivation of child of their basic needs, including the failure to provide adequate supervision, healthcare, clothing, or housing, as well as other physical, emotional, social, education, and safety needs. Now, it's a very important issue, in part because in 2019, more than 650,000 children suffered from child abuse. At least that's what was reported. Probably there are a lot more that were not reported. That obviously is a great source of concern as well. It's also important because more than 1,800 children died from child abuse in 2019. Now, there was a slight downtick from 2018, but we don't know what the statistics will look like for 2020 yet. At least I don't. Perhaps my guests have more up-to-date information on that. The most common form of abuse, again, is neglect. And so we will talk somewhat about that as well. And the most common perpetrator of abuse is the mother, surprisingly. Now, in part in response to these kinds of issues, governments all around the world have taken advantage of what's referred to as the parens patriae principle. And basically this principle states that the government is responsible for the care of its citizens. And so we have governments all around the world having initiated policies and laws to help protect its citizens, including especially its children. So we have, for example, the Convention on the Rights of the Child that was passed by pretty much every country in the world. We have also the Global Initiative to End All Corporal Punishment of Children, which is ratified by about 60 nations, I believe. And so obviously governments take this very seriously. At the United Nations, there's somebody called the Focal Point on the Family, whose job is to look after family interests in different countries and work with them. And there's a committee on the family as well that is interested in family issues and parenting. So there's a great deal of national and international concern about this. Now, surprisingly, I found that the most common age of abuse is less than 1 year old. So I want you to think about that for a minute, right? How does a 9-year-old child who's being abused apply for help? Who's going to help that child if the child's being abused in the home? Obviously, the child can't reach out to anybody. There's got to be somebody who steps in to help. And so, again, most governments around the world, and definitely including New York State and New York City, have instituted some kind of policies and agencies that are intended to protect not only adults, but also children. And so here today, we have two guests who are particularly knowledgeable about these issues and who I hope will shed more light on some of the things we can do to not only deal with the child abuse, but also prevent it. By the way, it may seem like this is only an issue for children in the moment that they're being abused, but it's not, because the consequences of abuse can last a lifetime. Right? Apart from children who are killed by abuse, there are children who are perhaps beaten too much or deprived in other ways, and the consequences like this can last a lifetime. There's all kinds of evidence showing that maltreatment of children causes things like decrements in IQ scores, difficulty learning, later behavioral problems. And so it's not just an issue that's important within the family for that particular child, but sooner or later, the rest of us are going to have to come into contact with the consequences of these behaviors. Right? So that with a child misbehaving in the streets, or a child who eventually develops criminal tendencies because of all the trauma they've suffered It's something that all of us should be concerned about. And so I'd like to speak with my guest today about some of the things that we're doing, or they're doing, I should say, to help deal with child abuse. Now, we all know about the Administration for Children's Services, and I think sometimes maybe they get a bad rap as being those people that are going to take your children away. And I think that's not fair. They have a responsibility to protect the children, even the children who, whose parents are not admitting to doing something wrong when they actually are. And so I don't think that's their favorite part of the job. Nobody wants to do that, but they do step in, and they're providing a wonderful service for us. And it's something that I think we should all be grateful for. So one of the things that I think they don't get enough credit for is their program in child abuse prevention services. And so they have a number of initiatives in place to try to reduce the incidence of child abuse and to help parents who are under a lot of stress and maybe think that there's a risk that they're going to not be able to care for the children appropriately. And so I'd like to begin by asking you, what are prevention services?
Well, Dr.
Hansell?
Lau, yes, Dr. Lau, first of all, let me say thank you so much for giving Dr. Martin and me the opportunity to speak with your listeners. We really appreciate this. Child Abuse Prevention Month is a very important time for us. It's a great time for us to talk to people across the city of New York about the importance of keeping children safe, keeping children, protecting their well-being, and how really child safety is everyone's responsibility. So we very much appreciate the opportunity. Let me start by saying, at ACS, we feel that our core mission is making sure that children are safe and that families and parents are supported. And we really see those as two sides of the same coin. And let me explain why. What we do is whenever a member of the public, and it can be anyone in the public, calls the state, what's technically called the statewide central register, but I think is commonly referred to as the child abuse hotline. When anyone across New York City calls and says, I think a child may be in trouble, that call gets referred to us, and we are required by state law to do an investigation and to determine whether a child is at risk. And we do that tens of thousands of times a year, every time one of those calls comes in. We often don't find any issues of concern, although we may often find ways in which we can be helpful to that family. But often we do. Often we do find that there are safety issues in a home, that a child is not in a setting in which their well-being is secure. But even when that's the case, our response is not to separate families. Our response is, whenever we can, to keep families together. And we do that by trying to understand what the challenges are that a parent or a caretaker is facing that is leading to an unsafe situation for that family. We all know parenting is difficult. Parenting is complicated for all of us, and all of us experience challenges in parenting. And some families, some parents experience more severe challenges than others. And so our goal in these situations is to understand what the challenges are that are at the root of creating an unsafe situation for that child or those children, and then providing the parent with the services or the supports that will address that underlying challenge. And that way we are able to, in the vast majority of situations in which we work with families, we're able to keep families together, keep children safe by providing supportive services to the parents or caretakers. And the primary mechanism we have for doing that is what we call prevention services. Those are services that are offered by community-based providers all over the city that we contract with. They offer a range of services, and they really are kind of our frontline providers for responding to the challenges that families are experiencing and making sure they have the support they need. And Dr. Martin is the leader of that program. She's the Deputy Commissioner for our Division of Prevention Services. So I'd like to give her an opportunity to talk in a little bit more detail about specifically what you asked, which is, what are our prevention services?
Yeah, thank you, Commissioner Hansell. And as Commissioner Hansell said, thank you, Dr. Lau, for this opportunity to chat with you about our services at ACS. And I echo much of what the Commissioner has said. So prevention services for us is something that we have been investing in now for over 3 decades. To meet the needs of children and families in New York City. And I am very proud to say that I've been a part of this process and now get the opportunity at ACS to oversee this work. So as the commissioner said, we contract with community-based organizations across the city to offer these services. And in calendar year 2020, we actually served over 40,000 children in almost 18,000 families across New York City receive prevention services with us. And so this continuum that we have really have earned us a reputation as a national leader. And these services are really there to strengthen families, to reduce the likelihood of placement into foster care for children receiving prevention services, also reduce the likelihood that children who are getting these services will be the subject of subsequent abuse and neglect reports. And we want to promote that permanency, supporting reunification of children and families that are returning from foster care to their families and in their communities.
I have a number of associates who either are social workers or attorneys or even physicians, pediatricians who deal with the child abuse. And they've all said pretty much the same thing, that you folks set a priority of trying to keep families together as much as you can. And so I think it's a great idea to add preventive services that try to deal with the problems before they get too serious and stop them from getting out of hand where you might have to remove a child. So that's something that I think a lot of people would be grateful for. Now, is there something called primary prevention services? And if so, what are they?
Yeah, there are indeed. Let me talk about those. And those are also something that more recently we have made a fundamental part of our system at ACS. So Dr. Lau, I'm sure you know this, and some of your listeners may as well, but in the world of public health, there's a lot of discussion about primary and secondary prevention, right? So primary prevention in the health world, primary prevention is preventing disease in the first place. So for example, something we've been talking about a lot lately, vaccination, to prevent someone from getting disease. And of course, today we're very focused on COVID-19. That is what we would call primary prevention. We want to stop a disease before it starts in the health context. Sometimes if someone does get sick, then we want to make sure they don't get any sicker than necessary. We want to give them treatment. And that in the health world is called secondary prevention. Well, we've sort of taken those public health concepts and brought them into the world of child welfare. So the programs that Dr. Martin was describing earlier are typically utilized in a situation where, as I said, we've received a report from someone in the community that a child may be in trouble. We've interacted with the family. We've found some indication of concerns. We've worked with the parents to understand what their challenges are. And then we connect them with the right kind of service to make sure that those challenges are dealt with and that family doesn't, as Dr. Martin said, have any further involvement with the child welfare system. That is what we would call, in a sense, secondary prevention. Something's happened that raises a concern, and we respond to it by connecting a family with prevention services so that they can address those challenges and move on with their life. But more recently we began to think, well, that's an important thing to do, and that's far, far better than placing children in foster care and separating families, which we try not to do except when it's absolutely necessary. But we thought, why should we wait until something has happened, something bad has happened in a family? Couldn't we intervene? Couldn't we get services to families even more quickly so that they wouldn't have to have any involvement with the child welfare system at all? And so a few years ago, we began to focus on what we now can call the primary prevention part of our program, where we actually invest in placing services in communities that are available to families having nothing to do with the child welfare system or involvement with the child welfare system. And we've done that through a couple of different models. We have several what we call family enrichment centers. We currently have 2 in the Bronx, 1 in Brooklyn. They are open door, walk-in facilities where families can come. They can bring their children or not, as they prefer. They can sit down, they can meet with community members. And actually, each of those family enrichment centers was designed in collaboration with members of those communities. When we set them up a few years ago, we went out to the communities, we brought people in and we said, what is it you need? What are the services you feel like you need in your community that you're not able to find, that you're not able to access? And we really designed the family enrichment centers to meet those needs. So that's one of the ways in which we interact with families and provide support to families and communities through what we would call a primary prevention approach. That is, working with them completely outside the context of the child welfare system. We also do that not through direct services as much as through providing information. There are a lot of things that parents need to know in order to keep children safe. That begins actually right after birth. For example, when I think as many people know, it's very important that new parents make sure that their newborns or their young infants are put to sleep safely. And I think many of us know there are guidelines about how that should be done, that they should, infants and newborns should sleep on their backs, not on their stomachs. They should be in a crib. They should not be sleeping in a bed with adults. They should not be having lots of blankets and pillows and things in the crib. So counseling families about things like that around safe sleep are one of the ways in which we help and empower parents to take care of their children safely. We've done that more recently around things like safe storage of medications. Medications that are safe for adults are often not safe for children. And so we want to make sure that children don't get into medication that is not intended for them and that can be dangerous. So we have counseled parents about how to safely store medication. We've actually provided parents with lock boxes and bags where they can literally lock their medication up so parents, the little children or toddlers can't get into it. So there are many ways in which we can support parents by direct services, by information, and various other ways to help them keep their children safe so that the child welfare system never has to be involved. And that's really what we mean when we talk about primary prevention.
In my last show, I talked about the proactive discipline, the things that parents could do to prevent child misbehaviors from occurring. To hear somebody from a city agency talking about proactive activities in this way is unheard of. I don't know of any other city that does this. In fact, I don't know any other agency that does this. I hope all your colleagues in other agencies are listening, because if we can stop the incidents of misbehaviors from the public at large, that'd be terrific. I think it's a great idea. Now, who does this training for the parents?
Well, we actually have a lot of training models. Dr. Martin can speak to this in more detail than I can. We actually have, within ACS, we have our own training capacity for our staff and for the staff of our provider agencies, the community-based organizations that Dr. Martin mentioned. We have what we call our Workforce Institute that provides a very extensive curriculum actually for both our ACS internal staff and for the staff of our provider agencies. And then we have a unit, what we basically created when I started as commissioner here about 4 years ago. We set up what we call the Division of Child and Family Wellbeing. And it actually is, I have to say, Dr. Lau, to your point, we are the first child welfare agency in the country to create a dedicated component focusing on primary prevention. And that is our Division of Child and Family Wellbeing. And they have a team that actually goes out into the community and provides training, materials, and other things directly for parents and families. Dr. Martin, would you like to elaborate on that?
Yeah, I mean, I think Commissioner, you're right on point with that, and I think we also do significant collaboration with our colleagues at DOHMH and health and hospitals, to ensure that families are getting the information, especially around safe sleep. But we also, through the Workforce Institute, ensure that we are supporting our contracted agencies. And so this is an opportunity for them to also get that cutting edge, keep our work, informed by innovation. So, for example, we have a number of evidence-based models as part of our prevention delivery system. And so it's really important for us to partner with the developers of those models and support our agencies to ensure that their staff are well-trained in safety and risks, as well as, the evidence-based approaches, those counseling approaches, those therapeutic approaches to meet families where they're at and ensure that we are supporting not only the workforce, but also the families with the coaching that they need as they partake in our services.
That sounds like a great idea. I'm a little confused though about who's providing the services directly to the parents. On the one hand, I thought you said that the services are provided by trained staff within ACS, but then I also heard you say something about community agencies being involved. Could you clarify that for me, please?
Yeah, sure. So ACS does not provide the prevention services directly through our agency, but we do contract with nonprofit agencies who have been providing and serving these communities across New York City for many decades. And so we contract with them. They provide the work. For example, they visit the families in the homes. They work very closely with the parents and the children in those families. And we work with the agencies, making sure that we are also supporting them so that they can deliver, those quality services that families need.
So would these agencies be, say, community centers or daycare centers or something else?
So they're multiple, they are agencies, nonprofits that have been in communities, and they may provide multiple services, not only child welfare services. So assuming that I'm going a little off script here, make sure that I, don't mention some agency names and not others. But, they are community-based organizations. They work with other city agencies as well, not just ACS, but providing those core services to children and families. So for example, Children's Aid Society, and New York Foundling are just a couple of those agencies that we contract with.
And I think I might add, because I think it's important to your question, Dr. Lau, is our prevention services actually are provided in home. We think it's important for us to go to families, not to make families come to us. So the case planners and the staff from our prevention agencies actually go to families' homes, interact with them. Obviously, a lot of that changed during COVID, and we provided services in different ways, and much of it was virtual. But we feel like it's very important for us to have the interaction with families in the manner and location that is most comfortable for families. So these really are services that, at least in normal times, are provided in home. Now, I might mention, actually, because you asked about daycare centers, we do have another part of ACS that is responsible for much of the city's childcare system. And so we do provide support. We work very closely with the Department of Education on this, but we do help support the city's childcare centers, what the New York City calls our early learn system. So there are definitely other mechanisms for getting services to families in other ways, but the services we provide through our prevention programs are provided to families in their homes or in ways that are really most conducive to their receiving the services.
But I can say from my study of the research on these issues that the evidence seems to show that when families get help at home, as opposed to going away someplace or to some kind of bureaucratic organization, it's much more effective. Because whatever, for example, you get to observe parents and children interacting in their own home when they both feel comfortable, and then you can offer suggestions, which if done properly, which is with sensitivity, then I think parents are going to be more receptive than if you just have them go to some kind of a bureaucratic building where they don't feel comfortable. So I think it's a great idea, especially having the community involved in providing services.
That's been very much our experience as well.
Now, you mentioned something else that I think is underestimated, and that is you talk about using evidence-based programs. And so let me ask you, how do you know your programs actually work? Is there any evidence to show that?
Yes, indeed there is. Dr. Martin?
Yes, that's a excellent question. And so, we have been talking to families, and we did a survey in 2019, actually, where we heard from parents how effective these services, have been, and also, what they would like to see us do, differently. But approximately 94% of our families that were surveyed, said that they were happy with the prevention services that their families received. And over 70% of them said that they would recommend these services to a family or a friend. So, we go by not only, the data that shows what the outcomes for families and children have been, but also hearing the families and the parents, who participated in these services, are telling us. And so we do appreciate that every family's experience in prevention services is different, but we continually are striving to hear from the family so that we can improve the quality of the services and the interactions that families have with us. So in July, one of the things that we strive when we started with our new contracts was to require all of our agencies to incorporate family voice and choice in their programming, in their organization, because we do believe that the family's experience should really be the drivers of this work. The evidence-based models that we use, many of them were, we sort of bought into our system from the juvenile justice, work. And so lots of the evidence is really on the, coming from the juvenile justice side. So our attempt here is really to add the child welfare component to these models that have proven to be effective with families and youth, and also to help our families, interact within the child welfare system and tell us what are the services that they need, what's working for them, and how we can best improve our services.
I think it's really important that you are doing that kind of research to find out how it's working. But you said something that I think relates to this as well, that I just want to follow up on a little bit, and that is in terms of juvenile justice statistics. So have you noticed any differences in the incidence of child abuse, neglect, or maybe juvenile justice problems in the communities where you started these programs?
Since we started the programs?
Yes, if you follow up to see, does it make a difference in terms of maybe reduction in the incidence of child abuse or juvenile justice problems in those communities?
Yeah, well, what we know is, and Dr. Martin refuted further, we do know that the programs, the child welfare programs, are having a beneficial effect in terms of reducing child maltreatment, reducing involvement with the child welfare system, and placement of children in foster care. So, for example, we have seen a reduction in the number of children in foster care in New York City every year for many years now. We actually are now today at the lowest level in the foster care system that we've been at in decades in New York City. And we attribute that success to our evidence-based prevention services. We know, as Dr. Martin said, I think, that families who successfully complete our prevention services are 5 times less likely to have another involvement with the child welfare system within a period of time. So they're much more likely to have received the services they need to kind of stabilize themselves and make sure that they don't basically return to our system, which is a very good outcome. And we also want to make sure not just that the programs were achieving those goals, but that families felt that they were achieving those goals. And so we also, a couple of years ago, we did a survey of families who had received prevention services and asked them what they thought. And we were very happy to hear that the vast majority of families told us that they were happy with the services that they got, that they would recommend them to another family member or to a friend, and that they felt the services really did help them to achieve their parenting goals. So, we have all those indicators. With regard to juvenile justice, which of course is a somewhat different system, we've also seen in New York City, we've seen a very significant decrease in the number of young people being arrested, the number of young people entering the juvenile justice system, and similarly, because we run the juvenile justice system ourselves, we've seen a decrease in the number of young people when they leave the system being rearrested and coming back. Now, I can't tell you we can attribute that to a relationship between our prevention services on the child welfare side and juvenile justice, but I can say we're seeing very positive trends, both in a reduction of child welfare involvement and a reduction in juvenile justice involvement in New York City.
Well, sometimes you see a correlation and you don't know the cause, but then maybe through subsequent research, you can start finding causal links between what you're doing and what the outcomes are. Yeah. So that's something to look forward to.
Absolutely.
I don't know if the public realizes how revolutionary this is. I mean, in the United States, we work with the medical model where you've got to get sick before a doctor sees you. And there's hardly any concern with trying to prevent these problems from coming up in the first place. So this is such a great idea that I'm really grateful you're doing it. Now, one of the concerns that some parents may have is if they go to your program or go to one of your centers and they expose their vulnerabilities and say, I'm stressed out. I think I might be abusing my children. I don't know what to do. I can't take this anymore. Is there a risk that then they're going to be sort of put in the system and be followed up and get negative consequences from that? And
No.
will that be held against them, or is it focused primarily just on helping them?
Yeah, no, I'm glad you asked the question because it is a concern we hear a lot. Dr. Martin, would you like to speak to that?
Yeah, I'm sure. So I agree. That's a really good question, and I can understand why families may have that concern. So a few things that I want to say, to that, we encourage families to seek help when they need it. And so these agencies, these nonprofit agencies have really been, as I said before, really embedded in the communities that they are serving. They are accessible to families, they're accessible, to parents. As the commissioner mentioned, for example, the family enrichment centers are in communities. Parents can walk in and they don't have to be concerned about having, files or anyone keeping track of the services that they have participated in or needed to access. It truly is a community model driven by those families. Their voices are part of designing and developing the services that they need in their communities to help strengthen their families. With regard to the prevention, the secondary, let's say, prevention programs, we've always had an opportunity for families to just also voluntarily seek out those services and ask for the help that they need so that they don't end up, with continued stressors or destabilizing their families, and they can get the help that they need to support their families. And so I think, I will say that, all of our, nonprofit agencies in child welfare, they are, required to elevate concerns around child safety and risks of harm to children. But that is shared with families immediately. And I think I want to emphasize that the focus is really on stabilizing the families, getting them the help that they need, connecting them with additional resources to really, stabilize and keep the children safely at home.
I think that's an interesting point to make, Commissioner Martin. I think that a lot of times parents and families are under stress because they don't have enough resources. And a lot of times there are resources available in the community that they don't know about. So just by going to a center like yours, perhaps, where they can be educated about all the resources that they didn't know about, I can easily see how that could be a wonderful benefit for the family.
Yeah.
Absolutely right. And actually,
yeah.
Go ahead, Doug. I'm sorry, Doug. Go ahead.
Yeah,
go ahead.
I was going to say that, I want to also say that families can access these services not only by just walking into the programs, but there is a link. We work very closely with schools, with hospitals, with clinics, with after school programs in their communities. And so it's really important that, there's no wrong door, if you would, to accessing these services. But families can, if they're more comfortable, for example, engaging with, their child's guidance counselor to ask for the help that they need, then they can also receive the services through other referral pathways. A pediatrician could refer a parent to these services as well.
And I was going to add, Dr. Lau, to your point, there, I think we all know this is the case in New York City. There often are services that are available and are out there, but families just don't know how to find them or don't know how to access them or how to apply for them. And that's a real concern. So, I mentioned our family enrichment centers, but what I did not mention something else we have, which is we call our community partnership programs. And these exist in 11 communities around the city. And their goal is precisely to connect families to services that exist in their communities, but that they're having a hard time accessing, because we really want to make sure that, so we don't want just families to come to ACS services. If there are other community-based services that will better meet their needs, we want to make sure families know about them and can access them. And so that's exactly what our community partnership programs do.
That's great. I think part of the problem is just knowing what's available, and the other part is then applying for those services. So, when they can connect with your agencies and get more information about what's available, that could be very helpful. Now, one of the issues that is kind of interesting here has to do with the kind of training you provide. Is that I imagine that there's sort of a very low bar in the sense that you clearly want to make sure parents are not engaging in behaviors that are harmful to their children. But that is so low that I'm wondering if that's the level you kind of work at in terms of training, just teaching them not to abuse their children, or whether you have a higher standard for what parental behavior should be like. I'm not sure if it makes sense. If it doesn't,
Yeah.
I'll explain.
Well, I'll answer, then you can, if you want to ask some follow-up questions. But, parenting is very complicated. And we all know it's not easy being a good parent. And there isn't just one standard or one form of parenting. There are many different ways to parent. There are many different cultural expectations and roles for parenting. So no, we don't, at ACS, we don't see our job as enforcing any particular model of what parenting should be. We want to provide information to parents that is useful to them, but we're not in any way trying to dictate how parents should parent or what the acceptable or appropriate models are. Our really only concern is that children are safe. And so, if a parent has their own way of providing love and affection to a child, is taking care of the child, and that child's well-being is being protected, that is not of any concern to us. And if a child does come to our attention for being unsafe because of a report that comes from someone in the community, our goal is just to work with a parent to make sure they can protect that child's safety and well-being, not to dictate how they should be parenting that child. So no, we don't have a particular expectation or standard or model of parenting. That's really not our place or our responsibility.
Deputy Commissioner Martin, did you want to add to that?
Yeah, I think I would add to the commissioner's comments. We also, provide services that are culturally appropriate, right? And so one of the expectations that we have is that, our services will meet parents where they're at, and that we will, work with parents within the context of their cultural norms around parenting, as well as, helping them, the parents, to strengthen those needs, sort of putting everything in context, right? So if there are specific language needs, we try to ensure that our services are also provided within the context of what a parent, the language that they speak, that they're more comfortable with. I think I would say that, we must consider the whole person, right? So the family is not just, from our perspective, they may need more than we can anticipate, as the commissioner said. It's more than just ensuring that the children are safe. It is ensuring that we are connecting with parents within the context of their culture, their language, their needs. And also, these services are also time limited, right? So one of the things that we don't do is also we don't dictate, how long these parents should interact with these services. The idea is that we're focusing on what they need in the moment. What do they need in order to strengthen and stabilize their family? And if we can do that through a short-term intervention, meaning 6 to 9 months, we'll do that. If the family, feel that they need a more long-term intervention. So, for example, if it's a parent who has struggled with substance misuse, that may take a little longer, right, for them to actually achieve that level of stability and be connected to the services that they will need long after we have exited our intervention with the family. So the parents actually have choices that they can make at this point. And certainly, they can choose to end services, prevention services with us, when they desire. Once
No,
their goals are met.
I might say, Dr. Kulak, because the way this question is often asked to us is whether families are reported to the child welfare system just because of poverty, not because of abuse or neglect, but just because of poverty. And it is true that many of the families that are reported to us by people in the community are poor, are living in poverty. And many times in which we work with families, our response is not about dealing with child abuse or neglect, but our response is helping families deal with the challenges of poverty, which are very real. So if a family is having difficulty purchasing enough food for their children, we'll help connect them with food benefits or food pantries or soup kitchens. If they can't afford basic things they need for a newborn or an infant, we'll get cribs for them or diapers or formula. So we definitely respond to poverty issues all the time. And we consider that a core part of the way in which we support families. But that's very different from what we consider a response to actually a child safety issue.
That raises another interesting question. For parents who are watching this show, who are not sure if these services are good for them or if they should go ahead and seek out your services, how can they know? How would a parent know when to look for your services?
That's a great question, Dr. Martin.
Yeah, I certainly think, again, if families are, especially during this COVID environment, we know that families will have needs. They may be, stressed. They may be thinking, I know I have, a newborn. How do I get the help that I need? As we said earlier, these services are provided to families primarily in the home. And during the COVID environment, we've also, many of our providers, have also moved to a telework environment where they are offering telehealth services, to families, recognizing that families, may know that they want services, but certainly concerned for their safety going out of the home or, going to an office setting. So they can access these services simply by, reaching out. They can call 311 if they, wanted to hear more about these services and how to access the services. But they can also visit our website. And find out about the prevention services, the in-home services. They will find so many connections to a lot of the work that we've been doing during COVID. And hopefully they will find those resources readily accessible to them. But I want to say that, I think parents certainly, they know their families best. They know when children are struggling, with their academics. They know when, when children are struggling because perhaps they're seeing signs of developmental delays, but they're not sure, right? So they can also reach out to us. We have so many resources available through ACS. To really connect families and help them determine what might be the best interventions for them, including our prevention services.
And Dr. Martin mentioned our website. I wanted to specifically make sure your viewers know, we actually launched during the pandemic, we launched 2 campaigns specifically to help family members, parents, and teenagers access services they might need. So we launched one campaign called Coping Through COVID, which is for parents and caretakers to find any kind of service they might need, whether it's childcare or food or healthcare or mental health services, whatever. On our website, they can find ways to access those services. And similarly, because we knew that COVID has been, it's been difficult for everyone, of course, but it's been especially difficult for teenagers and older adolescents who are isolated from their friends, well, frankly, it's great that, the high schools are reopening in New York City. So this is going to change, but up until now have been isolated from their classmates, from their teachers, coaches, whatever. So we also launched a campaign called Teens Take on COVID to provide resources specifically for teenagers and adolescents. And family members or teenagers can access all of those resources on our website as well.
What is your website again?
It is www.nyc.gov/ACS or /children.
Great. Now, I want to follow up a little bit on your answer to my last question, the previous question. Let's say I'm a parent who's at home with my children during this COVID epidemic, which I want to talk more about. And I'm not quite sure if your services are for me. I know I feel stressed out. I know, my children are struggling in school and they're getting antsy because they're indoors all the time. At what point should I reach out to you folks and ask for help? Or maybe not even ask for help, just to have somebody to talk to. Is there some way that a parent can know if they really would benefit by reaching out to you folks?
Yeah, I want to say that, our services are available to families, and they can access these services on any given day of the year. The services are available in communities across in every borough. We have these services accessible to children and families. I also want to say that the services are free. So regardless of a parent's immigrant status, they can voluntarily reach out to us and ask for these services. Families can request these services directly. As I said before, they can, perhaps there is another, community advocate that they are connected with that they can reach out. We deal with families, or prevention services are really there to meet families where they're at. A parent might be parenting what they consider to be, a child who is acting out. The behavioral issues, are very present. The parent cannot feel that they cannot cope and they need help. They can reach out for prevention services. A parent who might be in a domestic violence, intimate partner violence, situation, and they want to reach out to us, we can certainly work with that parent to get the connection to the services that they need, whether it is, helping them to understand their rights and the access to services, or getting relocated to a place where they feel safer. The services are accessible to parents that, as I said before, may be struggling with substance misuse, or they may even have an adolescent who is struggling with substance misuse and they want some help. Maybe it's the mental health, maybe it's the stressors of just being isolated and parenting a newborn. They can reach out to us. We have a program that families who are participating in prevention services can work with. It's called GABI, Group Attachment Based Intervention, where they can work, to sort of better understand what is their relationship with that newborn. How can they strengthen their bond and their, the intimacy with their newborn in such a stressful environment. So these are just some of the examples, but I would say that, if a parent just feels that they need help, reach out, talk to someone, and at least, get some sense about which one of these programs might best fit their needs. But, prevention services are there, they're free, they're easily accessible. And I would encourage anyone who's just having any sort of doubt or just questioning, their parenting abilities or relationship with their children to just reach out.
And you've already said that there's no harm in reaching out, so they're not going to be stigmatized or anything like that. So they might as well take advantage of these free resources with no strings attached.
Mm-hmm.
That's right. And I would add that the last year has been so difficult for everyone. I think everyone has been more isolated than usual, and no one should feel like they have to deal with the challenges of parenting during COVID on their own. There are resources available, and not just through ACS. There's Thrive NYC. There are other resources for people who are feeling stressed or kind of emotionally at their wits' end. So absolutely, as Dr. Martin said, Everyone should feel like if help is there, if they need it, they should reach out. It may take a while to find exactly the right service, but there are a lot of systems available to support them.
Since COVID, there's been concern expressed by a lot of mental health practitioners about an increase in the incidence of stress in our society. Have you noticed any of this in your own case, where maybe you have a higher incidence of either people calling for help or maybe higher incidence of abuse and neglect cases since COVID started?
Mm-hmm. Well, actually, interestingly, we've had a lower incidence of abuse and neglect cases reported to us. When the pandemic started just about a year ago and the schools closed in New York City last March of 2020, actually the number of reports that came to the state hotline that were referred to ACS dropped quite dramatically by about 50%. Now, that's not, when you think about it, not entirely surprising, because as I said earlier, I think most of the reports we get come from education, from teachers, healthcare providers, what are called mandated reporters. And of course, the schools closed, so the teachers were not physically seeing kids every day. They might be seeing them remotely, but not in the classroom. Many families stopped going to doctors for a period of time. They were not going to therapists as often, things like that. So many of the people who normally would see children on a regular basis weren't. But in any event, there was a very abrupt drop at that point. However, that's changed. And actually, the number of reports that has been steadily increasing over that time. And now we're back, not quite to our normal levels of reporting, but much closer than we were. But we were worried about that. Did that mean that things were happening to kids that we weren't aware of? And so we monitored our data very closely. We looked at the reports we were getting to see if they were more serious. We checked in with healthcare providers, with hospitals, emergency rooms, and so on. And we really actually did not see any evidence that children were at greater risk because of the isolation of COVID. We don't have any reason to believe that the child abuse and neglect increased. But certainly I think all of us feel like there's been a lot of stress created by COVID, a lot of stress about parents, parents who've lost their jobs, parents who've all of a sudden had to deal with working and childcare at the same time because their kids were home from school. So those are huge stressors. And there's no doubt they've had an impact on many, many families across New York City. And that's why we want to make sure that families know where they can turn for help.
I mean, superficially, it would seem like when there's such a drastic reduction of 15% in reported cases of child abuse and neglect, that everybody should be happy. But I'm glad that you didn't just look at that superficially and you actually dove a little bit deeper to find out if there's any underlying problem. It seems like it emphasizes the importance of all the members of the community, the teachers and other caregivers, healthcare practitioners, to really keep a touch on children and what's going on with them, and to sort of highlight their role as mandated reporters and really help everybody else by informing people like yourselves about the cases of children who might need more help.
Yeah, well, Dr. Lau, it's interesting you say that, because the data we have actually bears that out. One of the things we've seen during COVID over the last year is that a smaller proportion of the reports we've been getting of children potentially being maltreated, a smaller proportion have been coming from mandated reporters. A larger proportion have been coming from community members, family members, neighbors, and other people who were obviously concerned about children and want to make sure that they were taking the right steps to protect them. So yes, absolutely, to your point, it really does take a village to make sure children are safe. And this really just underscores how important that everybody take responsibility for child safety.
Right, and for those watching, please think carefully about this, because if you see a child who's showing evidence of abuse, whether it's a sudden, a bruise that appears out of nowhere, and the parents say, "Oh, the child's just clumsy," or something like that, it's really important for you to alert authorities to potential problems. And to be honest, most of these reports don't turn out to be serious or a problem, but some of them do. And you never know if what you're going to report is going to be a child who's seriously in need or not. So it's better to go ahead and report and hopefully it not be anything serious than to not report and have a child either injured or maybe even killed because of something that you didn't report about. Now, what kinds of activities are you folks at ACS taking or doing this month to celebrate Child Abuse Prevention Month?
Well, Dr. Martin is really our Child Abuse Prevention Month cheerleader, so I'll let her answer that question.
Yeah, so thank you for that. You know, we historically we have done in the last 5 years, we actually did a walk over from Manhattan to over the Brooklyn Bridge, you know, to our Brooklyn Borough office. And that's generally how we sort of celebrated. You know, we had providers as well as families, you know, join us over in that walk. Well, you know, since COVID, obviously, we've had to adjust. And so we're really excited about the fact that we have been able to move this to a virtual environment and still, you know, sort of partner with our provider agencies as well as families and children. But I think this is also going to give us an opportunity to reach a broader audience, which is those community members, other community-based organizations. You know, they will get to join us at some of the events that we have planned virtually. So, you know, we're going to have a number of sort of webinars accessible to folks so they can learn more about our prevention services. They can learn about where these services are located in communities. They will hear directly from the folks who are providing those services and hear from some of the parents that Commissioner and I have, you know, mentioned that participated in our survey, but hear directly from the participants. So we're going to kick off, you know, have an opening event on April 6th. And, you know, folks can visit our website to see how to access that program. And then we're also going to have a media day where we will, you know, be showcasing, I think, and mentioning much of the work that our agencies have been doing and connecting. Families can also connect to those services that way. And then we're going to wrap up the month just recognizing some of our, you know, very courageous and heroic, you know, staff that have been, although we are in a COVID environment, continuing to visit families and children, you know, agencies that are ensuring that their staff are safe and feel safe and supported to continue to visit and support families. So we're really excited about all of this, but more importantly, really just being able to reach a broader audience with, you know, with our services that we offer, our prevention services.
That's great. So this is a really informative interview. So thank you so much for spending time with me today and informing the New York City public about your work, which I think is just amazing work. Is there any place where parents should go to get more information, or should we just direct them to your ACS website that you mentioned before?
Yes, indeed. Well, first of all, Dr. Lau, thank you so much for giving us this opportunity. We always are eager to share this information with members of the New York City community. And yes, your viewers who'd like more information can either call 311, which can refer them to any of our services, or they can go directly to our website, which, as I said before, is www.nyc.gov/children.
Great, thank you very much. For those of you watching today, I hope that this has been informative and that you've enjoyed as well as been informed by what we've talked about today. So thank you for joining us, and I look forward to seeing you next time. Bye-bye.